Tell me the scope of the practice here.
3 surgeons and a physiatrist, as well as 2 PAs in our practice. So Dr. James does a lot of the sports and knee reconstructions. Dr. Stuckey does a lot of the advanced hip and knee reconstructions, revision reconstructions. He does the partial knee replacement. All of us do general orthopedics, as do I. My scope of practice is general orthopedics, but last year I did 450 operations. 277 of them were shoulder operations. So I basically do more shoulder than anyone around, except for towards Charlotte or in the Asheville area. And I probably are on par with guys there in that. Dr. Fiore is our physiatrist, which if you don't know what that is, that's a non-operative, non-surgical back and neck specialist. So he helps try to get people better from their back pain and their neck pain without doing surgery by prescribing directed therapy, special medicine regimens, injections if necessary. We do injections right here in our office, which can sometimes be cheaper for the patients than if they go to a surgery center. Our PAs both support all of the doctor's efforts as well. So we really have a team approach and feel like we can take care of most things. As if there's something that's out of our comfort zone or really requires super subspecialty care, then we have a quick conduit to get people downtown to the right guy in the CMC system. So that's a big help as well. Stuckey and James and other surgeons here in the community were certainly doing shoulder surgery before I arrived. When I arrived, I think we started doing more and more surgery. We had to buy some extra equipment. We tried to do some new and different things. Even since I've been here in 2001, even since I arrived, orthopedic shoulder surgery has changed. Advances have been made that are remarkable. Here in 2008, 2009, you wouldn't expect it, but it's true. Advances are being made out of basic materials like metal and plastic. So things that used to be incredibly difficult to fix, we now have great solutions for. Proximal humerus fractures, we used to just sort of hang our head and hope for the best. There wasn't a great operation for it. Now we can get those fixed, get the patient home the next day, and have them start moving their arm right away. It's amazing. Just 3 or 4 years ago, the FDA approved a reverse total shoulder replacement, which is, thank goodness, a solution for the patient with a massive cuff tear that couldn't lift his arm. When I first arrived in Shelby, there was no operation to do for that patient that worked well. Now we can put in reverse total shoulder replacements, give them great pain relief, give them the ability to raise their arm up over the horizon, hopefully feed themselves, touch the top of their hair, care for their hair, helpfully remain some independence so they can move and use their arms in their own home. These are advances that are constantly being made, and I've had the great fortune of bringing a lot of these to Cleveland Regional. We're doing arthroscopic cuff repair surgery, and not just me. Dr. James is doing those, and the surgeons in the other group are doing those. So the great thing about CRMC is they've always welcomed change for good, change for the good of the patient. They've embraced all my crazy, new, and weird and different shoulder operations. They've allowed me to be the best surgeon that I can be, and I'm grateful to them for that.